We'll be joined by via Zoom by former Minister for Health and member of the NDC COVID-19 team, Mr. Alex Segbefia. He's my guest, so we have a conversation further on how we are managing the case following the reviews that the Ghana Health Service has introduced. Mr. Segbefia, good afternoon to you, and thank you very much for your time today. Okay, so we're muted again. Let's try and unmute, and then we'll start the conversation. Okay, so just to acknowledge you, I want us to go through this EI details, and then I'll come back to you and we'll have a conversation about what your side thinks about our management. It is a bit obvious, but we'll interrogate it a bit further. So the EI 164 makes wearing of masks mandatory, and it states, now therefore, in exercise of the power conferred on the President under subsection 1 of Section 2 of the Imposition of Restriction Act 2020, Act 1012, this instrument is made this day, 14th day of June 2020. Wearing a face mask or face covering. Says 1, a person shall wear a face mask, face shield, a face shield or any other face covering that covers his or her nose and mouth completely when that person is in a public place or be leaving or returning to his or her place of abode duration. 2, subject to paragraph 5, the mandatory wearing of face coverings under paragraph 1 shall be for a period of not more than 3 months. Geographical areas, and it goes on to say that this instrument applies to the entire territory of Ghana. How is it going to be enforced? The police may undertake random checks to ensure enforcement and compliance to paragraph 1. And a person who fails to comply with paragraph 1 shall be subject to the sanctions specified under section 6 of the Imposition of Restriction Act 1012. So that's the new executive instrument, making wearing of masks mandatory, and not wearing it, of course, an offense that could take you to jail or end up making you pay about 1,200 to 6,000, 12,000 to 6,000 cedis. Mr. Segbefia, it's good to have you. I want to take your thoughts on this new EI. Certainly, in terms of case management, one of the key problems we have found is people not wearing the masks, which we believe is spreading the COVID-19 further. This is a clear case of a government that is committed to making this stop with an EI that makes wearing of masks. This is unprecedented, mandatory.
Well, we welcome the EI in terms of making it mandatory for people to wear masks. I feel from the first and foremost, I must make the point that the flag bearer of our party, as well as the COVID team, including myself, had asked for masks to be worn almost 4 weeks before masks were agreed to be worn. And that delay, we should have done it a lot earlier. So we're grateful that government then decided to do it. But when they decided to do it, at that point, they should have actually made it mandatory from the onset, not optional, because we had already begun to see signs of indiscipline of our very own, including myself and others, but the Ghanaian doesn't seem to want to follow instructions freely, like some other parts of the country or of the world, especially the Asian territories for other reasons. But there's this level of disbelief in the fact that there's an illness. It won't affect me. If I swim in the sea, I'll be fine, all manner of things. So the education was already a problem, and therefore this CI is good. It's come at a time when it's needed, but it should have been earlier. And that has been one of our criticisms of government, that government has delayed in implementing certain things. Yes, this should have been, was brought in earlier. The CI should have come in a lot earlier to make it mandatory for people to actually wear masks.
From where you sit, is it clear to you exactly what ought to be done in terms of enforcement, which remains one of our biggest problems in this country?
A lot has to do with the education. We are either not communicating right or dealing with the communication in the right manner at the right time, because it is not sinking in. And government has itself to blame for some of this because of the mixed messages government agencies are sending out with regard to COVID. So if the government is telling everybody, try and stay at home, only go out if it is necessary, keep social distancing, try and ensure that you always have your face mask on. But unfortunately for governments, they are having their primaries now. And even though in some cases you see the people who are campaigning and contesting wearing masks, there are other instances where you see the total lack of social distancing and the total lack of face mask. You then have, in the same vein, a government institution trying to give out cards, the National Identification Authority, and people have queued, but there are no machines. So the queue stays for long, people are waiting, the machine is not arriving, and you are actually giving COVID an opportunity to spread even further. So it's not like the thing is even moving, because the machines are not even there for people to do their registration or to actually, but people are still queuing because they don't want to lose the opportunity to be able to register and also get. But if these are government institutions carrying out all these issues under the guise that we have things in place that can be dealt with, it shouldn't come as a surprise to anybody that people think that, well, it's business as usual, nothing really is happening, because although the government is saying this, there are people doing the other, and so really there's nothing to be worried about. Let's get on with our lives. And that is exactly what's happening in Ghana at the moment.
As it stands now, we have a registration coming up. The numbers are going up. Health professionals have raised concerns about how we're doing. And it's not just because of how government has handled it, it's also because of our attitude. You've spoken already about communication. What else is the NDC COVID-19 team recommending from where we are and the things that we need to do? The registration, the election itself in December. Any ideas?
We are recommending that the government take steps and use the steps it's going to take as a means of getting people to understand that we are not in a good place with COVID. The figures are rising. More people are becoming critically ill. And the rate at which we are going, it's not going to help anyone. So what you need, the government needs to be doing is for the government to be saying to its institutions, EC, NIA, is this a good time to be doing this product? Join those who are actually talking to them, even if you feel they are independent, saying that, look, this is not exactly, it's not working. We've done our best, but it's actually not working. And in one swoop, you would get a clear message to the whole of the country that because of COVID and the seriousness of it, there should be no need for us to be going through this. Because in actual fact, there is a register. We may think it's not the best, but for now, it must serve the purpose because we have a pandemic on our hands and it is moving widely. First step to be taken. Then they must look at the kind of education and who's getting the education and at what level. Because then when you get all the government agencies in sync, realizing and doing things that enhance the belief that there's COVID, people then begin to take notice of the fact that this is happening and it's for real. But our former president said yesterday, and you played the tape, get the district assemblies involved, get chieftaincy involved, make them the fulcrum and be at the forefront of the education process. So it's not just the TV and the radio. I've watched programs, you see it on TV, once in a while you get it on the radio program, but they are not going to cover the day-to-day, week-to-week aspect of it. If the assembly people were involved, the chiefs were involved, and this message was going around constantly, I'm sure that the message will be clear. We also need to ramp up, really ramp up, not just the rhetoric, on PPEs for the frontline staff. It's getting to a point where the excuses are no longer washing. They are getting ill, it's not helping, they are worried. And it was all well and good when we started off by saying, and people were talking, we'll sort it out, we are doing, but they are just not enough. What is going on? Come out and explain. The nurses and doctors need their PPEs. When are they going to be available? Because now we've started opening schools and they also need PPEs. So the demand for PPEs is going to go up. what steps has government taken to deal with these issues? That is our concern. And this is a constructive criticism. It's not about NDC MPP. We want government to act and give us the information.
I just want to finally ask you about what your team perhaps has picked up on the ground. We've done reports, several reports that show that our institutions or the health professionals themselves saying that our institutions, health facilities seem to be overstretched at the moment. The last time I spoke to you, you indicated that we should focus on the ones that were already in progress and finish those up. I'm wondering what information your team is picking on the ground in terms of the pressure that's been exerted on the health facilities at this point.
We are clear in our mind from the statements we are getting and from comments from people on the ground that the institutions that have been designated and have been earmarked for COVID are under a bit of pressure. I heard someone saying, look, there's a lot of space in the Pentecostal, I think it is, premises where they have quite a bit of space.
Yes, in Kaswa.
Yeah. Now, what use is that to somebody in Kumasi? Are we going to evacuate people to come down? So one, it's not just the numbers you have available, it's where they are. What steps are we taking to ensure that the isolation centers and the areas we are putting down for COVID patients are in the right place, sufficient enough to deal with the problems? Because if you send 20 or 30 patients to Kolebu, for example, currently, you will be hard pressed to keep them all in Kolebu. You have to start farming them out or sending them to various places, and so on and so forth. But there is definitely a lack of space. People are, I mean, we've seen the letter that went out. People explained the letter, some couldn't explain. There are many reasons. Why is it that the Ghana Medical Association is coming up and saying, look, the position we are in is, we should look at it. In terms of what came out from the WHO and the change in the number of days you're going to keep people who you say are asymptomatic, and therefore they can go home after 3 days, you have to make the distinction between the three terms that we use now. You have somebody who is symptomatic, who is showing the fact that he has the symptoms. Mm-hmm. You have somebody who is asymptomatic, who is not showing the symptoms. Yeah. But actually, the asymptomatic person can also be pre-symptomatic. In other words, he's not showing it yet, but he may show it, or he may not. But there is no way of knowing whether he is or he's not going to be. So we are in very, very dangerous grounds as to, you have to look at the person's history. How long has he been around? Did he just pick it up 2 days ago or 1 week, or has he had it for 3 weeks? You don't know. And so you just given the 3 days, you must then say, look, it's not that the person is going to be let out. The person must go under very strict quarantine because actually he is positive. And there is no rule that says that, no, WHO hasn't come out categorically and said that asymptomatic people do not spread. They say there's a low chance of them spreading, but they do spread. So, and you don't know whether it's on the 2nd day, the 9th day, or the 14th day that they begin to spread. All you know is that they are capable of spreading. So you can't treat them any differently. But
Mr. Segbefia, at least over the period we've been using 14 days, even for the mandatory quarantine, we'll be using 14 days, and it's working. So why not we just continue? And I think, don't you think the point that the Ghana Health Service makes about letting asymptomatic people go after 14 days is that we need a space essentially to take on the other people who need hospitalization?
Gifty, I think we're on the same page. Okay. Yes, if it's after 14 days, I don't have a problem. I have a problem when it is after 3 days or after 5 days, because that is actually done to create space. But we are already sending people home. So let's not make it as if it's a kind of a new policy. When people are around for a while, and even people come fresh and there's no space, they send them home and say, you hear it, these people are self-quarantined. under self-quarantine.
Yeah, if I may come in there with just this quick, my understanding, which is what the Ghana Health Service has said, is that they do assessments, and these assessments help them to determine whether or not a person can self-quarantine or self-isolate without necessarily passing on, or without the possibility or potential of him or her passing on the virus to someone else.
Yes, I'm not against the assessment, and we don't have a problem with that type of a situation. All we are saying is that whatever assessment is being done, it should be a little bit more rigorous, because then why are the numbers going up? The numbers are going up. The spread is getting worse. We are doing something, we may be doing something that is not right, or it may just be the nature of the illness. Whatever it is, the numbers are going up. So once you start relaxing and putting even more ill people into the system, what may actually be happening is that you're giving an opportunity for further spread. Between all this happening, at a time when numbers we're having three major things going on. And by next month, it's going to get worse. Why? Because we've had, by tomorrow, you're going to have the MPP primaries in a number of areas. A lot of people congregating, voting, etc. Beyond that, we've already started with the National Identification Authority picking up of cards. Also this week, they've also begun, I believe, for people who haven't registered before to be able to register. And then next week, come July, first week, second week, if the EC has its way, we will be compiling a new register. Why should we even think the numbers are going to go down? They're not going to go down. And they need this type of policies, because once these numbers reach a certain proportion, even in developed countries, they were not able to cope. Why should Ghana think that we can cope with huge numbers? So you have to put policies in place where people can self-isolate or self-quarantine or be kept for shorter periods and then sent to their areas of home where they can then be doing the self-quarantine and self-isolation, because we cannot cope with our numbers. But for some of us, we believe that we are already there, or at least very close to being there already. From the news we are getting on the ground, from some of the health facilities. We must take this very seriously. And we are relying a lot on the mortality rates. And that has a way of giving a certain false sense of security. But if we get overwhelmed and our systems are not able to cope with the number of people, our mortality rate will cease to be a matter to be able to look at and say, look, we are doing okay.
You said something that caught my attention, which is that it's possible that the disease has changed in character. So that's a concern that has come up in this week of assessment so far. Does your team think that it is mutating? Do you have any scientific evidence as yet to back that?
Well, no. I mean, we are waiting for the science. There's a fear and a concern that may be the case, but it's not been concretized. There's no. We can't on a hand and heart say that is the case.
Right.
But it has happened elsewhere. There are different strains of the same illness in other countries. So it would not be a big surprise if that occurred. The question is, what does that change do? Does it make it more easy for our bodies to deal with, or does it actually become worse? In which case, we will then have a bigger problem than we have. But we hope that at least we are still dealing with the same thing and can cope with it. We wouldn't know for a while whether this is actually the case or not.
You also said something that, again, struck me. You mentioned rigorous assessments, that you don't have a problem with the assessment. What you want is rigorous assessment. What exactly does that mean when you say?
You're reducing the number of days somebody is going to stay. You should be asking a lot more detailed questioning to give you a better idea what you're dealing with. Because what you don't want to do is to put somebody into the public domain, even for self-quarantine, which can then raise the possibility of further infection.
But is there any evidence you have that to the contrary, that the contrary is happening?
No, all I'm saying is that once you have reduced the number of days, if you're asking 10 questions now, you should be asking 15 or 20.
Right.
Period.
Mr. Segbefia, it's great having you. Thank you so much.
Thank you very much. Have
the time you take with us. Mr. Segbefia, Alex Segbefia is former health minister and also